My availability and my pursuit of healthcare has been anything but easy. You know, my life's been hell. Basically 50 years of hell. I have mental illness, which unmedicated and untreated can prohibit me from living. I mean, even one day unmedicated, it's like a struggle. It's just stop taking the meds because it's like, whatever, it's not helping, or I don't care anymore anyway. And everything just really started escalating.
Conceptually, it is really difficult for me to wrap my head around somebody giving up on healthcare. I mean, that should be as basic as food to eat, water to drink, air to breathe, right? And I know that food to eat isn't a given for everybody, and that's heartbreaking. But to give up on your healthcare, to me, is like, okay, everything's just going to get worse until I die. That's not living at all. That's just waiting for death. I look at the data in our service area. There's 150,000 people that still need care that probably don't have the means to get it unless someone like us is able to provide that.
I definitely wouldn't think at 18 I would be living on my own and doing things on my own. I was put in a really difficult situation with my mother, and with that, I didn't have anywhere to go, no clothes, no nothing. And with Brandy and Connie's help from Great Lakes Bay, they gave me all the resources that I need and more. I didn't really know where to start off, honestly. Connie helped me with food stamps, Connie helped me with therapy, and she also helped me with my Medicare card. She really made me feel comfortable in the position that I was put in. Being homeless and qualifying as homeless as a senior really isn't my ideal thought of my senior year, but made the best out of it. I went online for my second semester so I could go to Bayshire. With the school, my mom kept all my cosmetology books from me, and I had to go and I had to pay for my own books. Connie actually helped me out a lot about that. She helped me get a new cosmetology kit because my other one was busted. I couldn't be any more grateful for them.
It's a good collaboration that we have here with the school at Bay City Central, because it kind of went from one step to the next, to the next, to the next, ended up to me, and then I was able to assist her with a therapist. So it's good just to have like those community resources, the relationships within the school system, because even though we're not employees of the school, we still work together. So it's good just to have that teamwork.
So I got a 20 credit scholarship to Delta Community College through Bayshire and the Career Center for my associate's degree in cosmetology management, and that's what I'll be doing for the next year and a half. But my boyfriend Jacob, he will be attending Saginaw Valley for his electrical engineering. He was granted a merit scholarship, and with that, I think we're gonna have a great future. You can have a good life when you're dealt bad cards. It's not always negativity. With positive thoughts comes positive things. That is one thing that the health center has really helped me, is just focusing on one thing at a time. And with that opportunity to other students, it will just open new doors for everyone.
We want our communities to be healthy. Everyone, not just some people. Everyone deserves to be healthy. We're here to be that hope for people that have had to think, am I going to go see a doctor for this nagging thing? Or am I going to learn to live with it? Because if I get that care, well, I'm not going to be able to eat. What a terrible, terrible choice to make. We exist to give that person hope. You can have both. Heaven forbid, you can eat and feel good.
I've never been so mentally balanced as I feel today. And I don't feel I would have been able to achieve this mental balance and clarity and positiveness if it were not for the great inner workings, staff, and doctors of Great Lakes Bay Health Centers. One visit with Dr. Staines and some manipulation, no prescription pad. No prescription pad. That doctor did in one visit what 3 or 4 doctors couldn't do in Pennsylvania with all the fancy equipment and injections. She did it with just these. You know how awesome that was?
Even before I got here, the leadership has been talking about this concept of we've got these great services that we're offering in Bay County. And the fact that they're divided and none of them are really right in the center of a heat map of where our patients are, was always an issue. The idea of what if we brought everything under one roof and what if we had room to grow began to be more and more realistic, and then the need was undeniable to bring that dental care with room to expand, to bring that primary care with room to expand, and then to bring vision care, which tens of thousands of people in Bay County cannot find vision services that will take their insurance, and it's really expensive. And now we're coming in with a solution for all of that.
It's wonderful to have one place I can go do my eyes, I can see a psychotherapist, I can see my primary doctor, I can see my pain doctor. Just having them all affiliated and working with each other is wonderful. And if it was in Bay City, that would be even better, because I live in Bay City. You know, and when I know I got to go to Saginaw, it's got to be planned out 2 weeks ahead of time, because that's an extra amount of petrol we're going to use. And now you're planning to put that into one building? That would be out of this world superior.
The variety of services that we'll provide, really, it's a full circle, and it's what our patients deserve. When you're calling to schedule with some of our doctors, it's almost 2 months out for their third next available appointment. That can't be the solution that we're happy with. We are trying to be the safety net for the community for all of those needs. And so growth is something that has to happen because that need isn't going anywhere.
Honestly, I can't express enough the gratitude I feel for everyone at GLBHC, because I've been to shrinks before, I've been medicated before, and I've still flown off the handle. But with the works of GLBHC, I'm just happy. And I've never felt this purely happy a day before in my life.